So are you, though. Honestly, I saw your resume. I didn't have to meet you. I was like, yes.
You're like, bring her in. Get her in.
Call her immediately.
Yeah.
And I think, honestly, within like the first couple of minutes, too, I was like, absolutely.
Yeah.
We didn't really even get into too much clinical stuff because I was looking at your resume prior, obviously, like prepping for the call.
Right.
And I was like, she is managing some complex patients.
Yes.
You're in it.
They're so challenging, but I love it.
Yeah.
I love the puzzle, and I love, like, and people are so grateful. Like, these
They
complex patients who, like, they're like, nobody understands what I'm going through. And it's the same thing for functional medicine, right? They're like, no one's been able to figure out my gut issue.
Yeah.
And you're like, you just need to dig a little.
Yeah.
And like try different things out for your body.
Yeah.
And magic will happen. Like, things will unfold.
Truly.
So
I feel like I hear that too. People are like, I've had diarrhea for 10 years. And it's like 10 years. Oh my God. That's just one
awful.
example. But you know what I mean? People live with symptoms for
Right.
so
And they just
long.
ignore it, or they push through, or they're like, I don't have time for this, or no one is listening to me. And
Yeah.
I've told my PCP this like multiple times and not getting anywhere. Yeah.
That's our ideal patient, though. You know,
Yep.
been through all of that and are looking for a different way of doing things.
Right.
And sometimes, too, it's like they don't even know what functional medicine is.
Right.
So it's a lot of learning on both ends, you know what I mean? Like what they can do for themselves, but also how the model is different from what they're used to altogether.
Right. Yeah. Yeah. And I think explaining to patients the difference between terms, and I think sometimes staff don't even know the difference between terms. Like, there's a difference between functional medicine and integrative, holistic medicine, you know, and
100%.
just saying, like, this is just us getting down, digging in, digging deep, holding our hand, doing this together and sharing that journey together.
Yeah, more collaborative model. And then the holistic piece is more of like whole body approach, right? So you hit it. It's completely different. Even like you mentioned too, like integrative medicine is not always functional.
Correct.
And vice versa.
Right.
So
it's just a combination of Western traditional medicine with other approaches that are still validated and still research backed.
Sure.
But you're combining the two and integrative. But functional medicine is really using the specialty testing, taking extra time with the patients, really taking a good history and like delving in. Yeah.
And that really looks like spending the time, which they just don't have in the model.
No.
Which is why I think this approach is so different for people, because they're just not used to having our first visit is 75 minutes.
Right.
45-minute follow-ups.
You don't get that in traditional medicine.
No.
Nor do you get the provider investment. Like, we're invested in their healthcare. Honestly, we want the best for them.
Too much. I need to shut it off sometimes.
I know.
It's painful. This is not an easy job.
Right.
It really is not, especially when we'll get into your zodiac sign and how you were raised and all of that, if you're open.
Yeah, sure.
I'm a Pisces. I feel like I absorb a lot of energy. So there is, or are moments rather, that I have to like take time and kind of reconvene and come back a different, I don't know, version.
Yeah, and I think that's sometimes why we also have to walk the same walk as our patients and invest in ourselves emotionally and just like, but almost more so, I think, than our patients, because we do take their energy, we take their medical trauma, we take on their burdens, and so it's just as important for us to take a step back and meditate or do yoga or engage in our religion if we have one, or just do primal trust or vagal nerve stimulators, whatever it does to help bring balance to ourselves, because you're absolutely right, you know, like taking on other people's pain is a challenge in it of itself, right?
You're so right.
Yeah.
And I like how you said we absorb energies from the patient and vice versa. So if we're not taking care of ourselves, we're going to show up in a way that is not necessarily reflective of what we're hoping to give off, if that makes sense. Right. And then they can feel off put too if we're not grounded, if we don't feel confident, if we don't feel like we can take on their case. And even if it's like subtleties, you know, like that is something that I've noticed over the years of practicing, that patients can feel, and they don't like that, especially when they're coming from a place that they don't feel like they were taken care of in a way
Right.
that they were expecting,
They were
or they were
dismissed.
let down, dismissed, etc. So that is probably a bigger part of our job than maybe even I realized until now,
Right.
that we do have to show up.
Yeah.
Correct.
Yes, absolutely. If you think about Nightingale and how she said,
oh, I love this.
You have to create the environment, right, for people to heal in.
Yeah.
If we are creating an environment where people can feel their true best selves, then we need to show up in our true best selves to help them, to lead them. You know, I love telling my patients, I'm a guidepost. I'm not, I'm not a doctor, I'm some God that's going to wave a magic wand and heal you. I'm a guidepost to point you to a direction that you can go in for your overall health. But I want to be that safe space that they can come to with any problem they have, regardless of whether I can help them with it or not. I'm a safe space. I'm not going to gaslight you. I'm not going to dismiss you. I am here. And here we're going to choose your adventure of which way you want to go in order to optimize you or help you feel better.
Oh, I love that.
Yeah.
It's so necessary for them to feel, our patients, our members, to feel like they can bring us anything. And that's where the whole body piece comes in. And I say too often that I might not have all of the answers or know what to do immediately, but I will help you to figure it out.
Yeah, that investment. I'm invested in you. I am going to take care of you. And however that shows up, even if it shows up that you cry the entire visit and I listen, that's healing.
Yeah, that's healing. And that's nursing too. I loved how you brought up Nightingale for the listeners that don't know. Can we just spend like 10 seconds talking about
Let's do it.
Nursing
Yeah.
theory and Pioneer? She was such a pivotal person.
Figure
figure in the nursing career. And saying that we're showing up to care for patients is the difference between medicine and healthcare and medicine and nursing in general. Is that, yes, we use certain medicines to help people, but that is such a small piece of what we do as nurses.
Right.
We care for people and families in a way that I don't think the general public fully understands.
Yeah, I totally agree with you on that point. You know, there's such a big difference between, diagnosing or versus like treating someone for what's going on in their body. Because I feel like sometimes when you diagnose, you're giving people a label and then they feel like they are that label and they live that label. Whereas instead you look at it from a perspective of, hey, you have these symptoms going on. How can we heal you? How can we care for you? How can we bring some empathy and compassion to you in this hard time of your life? And so I totally agree. Like medicine and the diagnosing and treating and a pill for every ill is so different than what we do in terms of holistic care and looking at the full person and looking at everything that goes into what they're currently suffering from.
Yeah. And like you said earlier, like in the context of their environment and how they spend their time and who they fill their time with, all of that really matters and influences how their health is expressed.
Yeah, absolutely. I mean, isn't that the foundation for functional health is really like looking at a person both in their environment and their spiritual development and what are they feeding their bodies with and what are their stressors and how are they sleeping and how are they spending their free time and who is surrounding them and what kind of toxins are they being exposed to. It's not just, hey, you have diabetes. It's all these other factors that go into a person's healthcare and health.
You're so right. I didn't expect that we would go here, but who's your favorite nursing pioneer?
Oh, man. So
You brought up Nightingale, so
I
have
did.
to ask.
I did bring in Florence Nightingale. It's really funny. I took an ethics class with Sister Callista Roy at Boston College, and I think her approach to nursing ethics was one that kind of put me on the path for functional medicine because she talked a lot about the whole body and the holism and but she didn't use holistic. I think that would have been a little bit too out, but she used terms like consider the whole person rather than the little minute different parts of the body. Consider the whole person. And I think that really kind of changed my mind about how I care for patients as a nurse.
I love that.
Yeah.
sometimes too, patients really me as a human patient also, you think it's one thing and you stay so hyper focused on that one symptom or that one area.
Yeah.
And if you do spend the time and ask the right questions, come to find out it's something else. And those two things could be related. So that's why staying more focused or zooming out really on the whole person is so important.
Right. And it speaks to the intakes too. Why we spend so much time with a patient in that first visit is it almost feels like a little bit like 20 questions, but it's really intentional.
Yeah.
We're really trying to look at the whole person and what is going into their overall health. And I think it's such an integral time, I think, that first appointment with the patient of really getting to know them, asking questions no one has ever asked them, and helping people kind of also connect the dots within themselves of what's going on. So I love those first appointments, just really getting to know people.
Absolutely. They are long. They can be heavy.
Yes.
Tears do happen.
Oh, yeah.
But usually they're therapeutic. In a way, at the end, they're like, oh, I feel hopeful. And that's my goal for the first visit, is just to offer some hope.
Right.
And try to understand what's going on and have a plan, of course, with diagnostics and next steps and all of that. But my main goal is for our patients or members to leave that appointment feeling somebody gets me.
Right. Someone gave me space. Someone's listening to me. And I feel cared and held in this moment.
Totally.
Like I feel like I matter and my health concerns matter, because they do.
They do. This is so personal. I say that too a lot, that this is the most personal aspects of somebody's life. And I think it's hard to share sometimes to a stranger.
Incredibly. To be vulnerable with
that's
someone
what it
you've
is.
never met before. And sit down for 75 minutes.
And it's probably like the 10th, maybe more time that they did that. You know what I mean? So it's just, it is a lot.
Yeah.
I want to back up. And I want to talk about your education.
Sure.
You said Boston College?
Yeah.
Yeah, that's where you went?
So that
where
was
should we
my
start with that? I want to
master's.
hear everything.
Yeah. So
Just for the listeners, because everybody's getting to know you.
Absolutely.
And this is a good opportunity for you to tell us about your upbringing and all of that.
So I went to high school in Miami.
Oh, gosh. That's cool.
Yeah. My dad was Air Force.
Oh, nice.
So we moved down to Homestead, Miami area.
Okay.
And it was really hard for me, the heat. I mean, look at my hair. It does not do well in heat and frizz. No, I'm just kidding. But
I feel like nobody's hair does well in Miami. You just have to accept your
just
fate
go with
there.
it.
Yeah.
So I ended up going to Rensselaer Polytechnic Institute in Troy, New York.
Did the family come up?
No, they stayed down there. So I went to New York for my undergrad.
Okay.
I did.
This was undergrad.
This was undergrad. I did a pre-med, like a bio-psych dual major.
I did biologic sciences, something like that.
Yeah.
Yeah.
And it was my intention to go to medical school, but I took a gap year because I wanted to work in the hospital system and really make sure this is what I wanted to do. And so I worked as a CNA, a certified nursing assistant at a local hospital. And I met this psychiatric NP, and he changed my life. I saw what he did as an NP and how he touched patients and how he treated patients. And I was floored. I didn't know providers could be so empathetic and caring and give more time. And I shifted in that year, and I knew I wanted to become a nurse practitioner. And so I applied to a couple of programs and got into Boston College and did my master's at Boston College.
Love that.
Yeah.
And you stayed in Boston for a bit, practiced there for a while.
Yeah, I did a lot of family practice. I was a standard primary care nurse practitioner, had my panel of patients, saw patients every 15 minutes, 30 minutes sometimes.
Wow.
Did that treading water kind of thing. And I just it never felt satisfying. I felt that I really couldn't heal people. I was treating them.
How could you? 15 minutes? Not even? Yeah. Your appointments were probably like 9 minutes.
Right. Yeah. And, I saw a lot of kids that come in for coughs and colds and asthma and their immunizations and their well child visits. And, I loved taking care of families. I loved watching kids grow up. being, knowing the grandparents, knowing the aunts and uncles, knowing the parents, watching the kids grow. It was a unique and special relationship, but I just felt like there was more. Like there was more I could do for people instead of the in and out, you know? And that's what drew me to functional medicine eventually was I finally heard about it. And once I went through the IFM certification, you can never go back. You can never practice traditional medicine again.
You know too much now.
Yeah, knowing that there's a different way to care for people, that you're, again, to what I said before, you're not giving a pill for every ill. You're really getting to the root cause of things and treating the whole person.
Totally. Yeah, IFM is really an experience.
Yeah.
I just started it. I don't think I shared this with you, but I have a mentor and I practiced under her for 7 years or so. She's IFM certified. So felt like I had a front row seat and really dedicated my time to learning and understanding functional medicine. But this year I decided that I need to get certified because I'm ready. I have more mental space for it. But like you said, once you know, you can't go back.
Right.
We have the same board certification though. FMP.
Really?
Yeah.
Oh, cool. Yeah. ANCC?
Yeah.
Yeah.
Yep.
Great.
Just re-upped it.
Nice.
Had to do my CEUs.
Yeah, I know. That's a slog, right? Getting through all that every year.
I actually had a lot from, I didn't realize, I don't know if you use Up to Date, but every time you put in a search, it clocks
Really?
a tiny little C.
Oh,
yeah. So
that's kind of nice.
I had more than I anticipated, but I did the first, I can't even remember right now what the first IFM, the intro one.
Oh, the AFMCP, I think, is like the overall big.
Yeah. So I just did that one. I think that one was like 35 or something.
Yeah.
And then I had to do an opioid course for one of my licensures. You have a ton of licensures too.
I do.
So you have Connecticut, Mass, Georgia.
Yep.
You have New Hampshire.
Yep.
You have California pending.
California's pending. New York's pending.
Missing?
Vermont, Maine, Rhode Island, and Florida.
I love this for us.
Yeah.
I just got Virginia and Jersey is pending. And then I have the Northeast states, I think. I'm like trying to see in my mind.
Yeah.
Connecticut, Mass, New York, Rhode Island. I have California too, randomly. I have a family of patients out there, which we do care for families, by the way. I don't know if you have seen that in your practice in the functional space, but it usually starts with mom and then the kids come and then dad eventually comes and then parents, grandparents. It accumulates that way.
Yeah, it's really nice to see that. It's nice to see families, not just one person, but everybody understanding the benefit of functional medicine and what it can do for everybody in different ways.
Totally.
Right?
And sometimes too, going back to like the original conversation around people don't necessarily know what functional medicine is all about. Sometimes it is as simple as like, I found a really good provider and we're doing excellent work, or she's excellent. You should see her.
Right.
And they don't necessarily like have the conversation around functional medicine.
Right.
But just the referral is so powerful, getting families here.
Yeah.
I want to talk to you about your clinical interests. I mentioned earlier that you care for some complex cases, complex people.
Yeah.
Tell me what you like to see, or like who's your ideal patient?
I don't have an ideal patient.
Okay.
I kind of call myself a jack of all trades.
Same. We're we're the same person, because I say that too. I'm like, I'll see anything, but I'm not, I know a lot about, or a little about a lot.
Yeah, so to your question earlier about my zodiac sign, so I'm a Sagittarius.
Okay.
So I am constantly curious and I just want to explore, and I want to like know all the things, even though I can't know all the things.
Yeah.
So gut, yes. Hormones, yes. Longevity, yes. Complex cases like hypermobile Ehlers-Danlos and MCAS.
I have a card for that.
Yeah, I love all
hEDS.
that stuff. Yeah, I mean, it just fascinates me. Toxins, Lyme, mold. Yes.
Yeah, all the above. Same.
Yeah.
Honestly, I am the same. I mentioned I'm a Jill of all trades, I'll say, and we'll see pretty much anyone. But I do find the Lyme, mold, EDS, more complex cases, fun.
Yeah. Yeah.
I don't know. That's sounding a little fresh, but you know what I mean? When I can like really get in there and do some investigative work and bring in some of these pieces that functional medicine can offer, I think those are the most rewarding patients.
Absolutely. Yeah, when you can really help someone pull out of a really bad case of brain fog, or they have a long COVID situation, and you optimize their supplements and you look at their vitamins, and then you try a couple different things and they are able to feel better. I mean, it's pretty incredible what you can see sometimes.
It's so incredible.
Yeah. Yep.
You mentioned earlier you care for a good amount of kids.
Yeah, I do.
What's that like? We do too. I do too.
Yeah. So, in functional medicine, I was a primary care provider for a bit. And so we would do the well child visits. But I did have a good section of kids that had PANS or pandas or autism, and just kind of looking into how can we optimize their overall health? How can we meet them where they are? And is there something in their environment, or is there something genetically that's going on, or something in their gut that's kind of like a little bit of a speed bump, that if we can kind of ease out the edges and smooth out the edges, that their development is a little bit easier for them.
Yeah.
So I do have a subset of these patients. Sometimes moms are hypermobile or moms are autistic. So you'll see that in the kiddos. And so I think it's really helpful to kind of deep dive these kids and find out what's underneath the surface. Is there something that we can help them so they can like thrive in this current crazy world that we live in. Yeah, and I think testing can be super valuable and helpful for these patients to know, what are you actually going after? Is it an undiagnosed Lyme? Is it potentially strep, or is it a viral infection that's kind of been overlooked?
Totally.
So the problem I run into is testing's not cheap.
Testing is not cheap, and insurance plans don't love covering it. So parents are left with their hands tied because it's like, my kid changed overnight.
Yep.
And usually it's like more psychiatric, right? So it's scary.
Right.
And parents have to make the tough call of, do I invest thousands of dollars to test to understand what bacteria, virus, etc. it could possibly be? Or there's some parents that I work with that we start treating more broadly, and sometimes that makes more sense.
Exactly.
And if kids respond, we kind of use that as an assessment and go down that path. But it's really tough.
It is really tough. Or sometimes I'll just say, hey, listen, if we do a Cunningham panel, yes, this is going to be, $700-900. But if we do a gut microbiome, like if we run a tiny health, maybe we can see if there's some leaky gut going on. And in the grand scheme of things, by treating that in addition to the pandas, we're going to see some benefit. We're going to see some improvement.
We use GI map, very similar to tiny health. I think that's a different type of testing. I know GI mapping is PCR. I don't know if you know what tiny health is, but
it's PCR too.
Is it? Oh, okay. So probably very similar tests then. Yeah, it's nothing, or let me back up. We can cut this too. Sorry. One isn't better than the other, I wouldn't say.
Right.
A lot of the gut tests on the market are very similar, right? We're looking for genes of microbes, right? And looking to see if there's overgrowth of bacteria, evidence of leaky gut. Testing is really helpful, but we can start the work without testing. But I would advocate for testing if it's possible.
I know. I believe test, don't guess. I really think as a practitioner, it helps kind of guide my path as to what to recommend next. Otherwise, it's kind of like, well, we could try this, we could try that. I mean, I don't know if it's going to work or not, but we can try it.
Especially with kids too, it's tough. And when you're questioning antibiotics, it's better to have more visibility if possible. So let's back up a tiny bit and recap in terms of how patients kids with pandas typically present. So on my card here, I have OCD, anxiety, rage, tics, food restrictions, urinary symptoms, and regression. I feel like for me, clinically, what I'm seeing, and then I'd love to hear your thoughts on this, it's an overnight change in kids' behavior, and usually it's anxiety, aggression, or all of a sudden they're peeing the bed again and they're like 7 or 8. So been potty trained for a really long time. I mean, potty trained as a 7-year-old, that even sounds weird to say out loud, but you know what I mean? They have a regression that's marked.
Yeah, no, definitely see the same thing. It's this sudden change in behavior. I see a lot of the separation anxiety. Like they were fine.
Yeah.
And then all of a sudden they cannot leave mom or dad's side. And I think that's what I see frequently. And I think, and especially if there's no other change, they haven't moved, there's no new school involved, there's no change in the friend group, and it's just unpredictable and the sudden behavior. And then you can definitely see irritability, or you can see the aggression, or a lot of the OCD tendencies. And then I'll see tics. They'll have unusual movements of their mouth, their tongue, their eyes with blinking. I see that often too with the separation anxiety. So I think those are the two major symptoms that I see for PANS and PANDAS. And then sometimes the behavioral regressions, you'll see, the bedwetting at night, or you'll see the handwriting all of a sudden changes dramatically, or their gross motor skills are completely different, and there's no other explanation for it.
Yeah. I've seen too that kids randomly, something that they once really loved to do and had a lot of joy going to certain things, no longer want to. And it's like an overnight thing.
Yeah, and last thing I sometimes notice is the zoomies at night, where they never had zoomies before. They weren't wired and tired.
Yeah.
But then all of a sudden, every night they'll have the zoomies. That can be another sign too.
So bring them in, get them seen.
Yeah.
I think what happens though for a lot of parents is that they do that and they bring their child to their pediatrician, which they definitely should. I'm not saying don't, but they get quickly put into this box, which is more of the psychiatric piece, which is definitely important and meaningful. But I have had cases, and I'd love to hear your thoughts too, that the first treatment is medication around anxiety treatment or antidepressants even for kids. And none of this workup is taking place. And it may or may not help, but it doesn't really get them to their goal because we're missing that potential infectious piece.
Right. Yeah. Yeah, and I do think a workup by the PCP always recommended.
Yes, always.
Take a look at that, and maybe they'll even help us out. Like maybe they will do a throat culture.
Yeah,
maybe they are aware of PANS and PANDAS, because I feel like there are more and more PCPs that are aware of this. So maybe they'll do a throat culture. Maybe they'll do some documentation of things that can help us. But I do think, again, looking at the big picture and what are the exposures and what's been going on recently, and do they live in a moldy home? Were they out camping 4 weeks ago and possibly got bit by a tick? So I think it takes somebody asking those really important questions to kind of narrow down what's going on for this kiddo.
Yeah, asking the right questions. And sometimes, too, that comes down to time. Like going back to our previous conversation, having the time to do all of that can be the difference between getting on the right treatment path or not.
Right. Yep.
I want to pivot and talk to you about EDS. I know that you have more experience treating these patients. Tell me about what exactly is EDS.
Yeah, so Ehlers-Danlos syndrome is a genetic condition. There are 13 different types. 13.
Oh, wow, I didn't know that.
13 different types, but hypermobile is the most common type of Ehlers-Danlos. Now, the other types are fairly rare, like 1 in 40,000 or 1 in a million. But of course, you want to rule out the bad types that can lead to aneurysms or heart attacks at an early age. But hypermobile Ehlers-Danlos, I have a lot of experience in. It's not rare. It's 15% of our population, they think.
It's not rare.
It's
we have
not
a ton
rare.
of members.
Yeah. And it's just underdiagnosed. And I think what has been my mission over this last year is to help people get the diagnosis because so many people with hypermobile Ehlers-Danlos are bounced from specialist to specialist, and no one, not even the rheumatologists, will give them the diagnosis.
Yeah.
And they just need a diagnosis to be able to move on with their life, get the services they need, find hypermobile aware physical therapists or acupuncturists or chiropractors, and get a healthcare team that is aware of hypermobility and can treat them and help them with some of their health concerns that they have.
Absolutely. Walk us through what the workup looks like.
It's really
complicated.
No, it's actually not that complicated.
Okay. I thought that we had to do like, in my mind, complicated is like, I'm thinking of, I can't recall what it is, so correct me, but it's some sort of assessment that the PT has to do, I thought.
So, you know what? Before I delved into this world, that's what I thought too. I thought it was a special assessment that physical therapists do.
I thought you had to have like some sort of special training, and they had to get this like sign off from a physical therapist.
But you know, the criteria is set up by the International Society for EDS. It actually is changing December of this year.
Oh,
they're going to make it a little bit more inclusive because it is very black and white right now. But there's only 3 criteria, and you know, any provider can do it. You just need to know the 3 criteria.
Ooh,
and you need to
walk me through that.
Yeah, sure. So the first criteria is the Beighton Score.
Yes.
So that's where you're doing,
yes. Okay.
And you're assessing the different joints.
Okay, so we need to like say that out loud for those that are listening. If you're like pulling down your thumb, if you
and
can
you're trying to like pull your pinky back 90 degrees.
Okay, this way. Ooh.
Yeah. That's pretty flexible.
This is pretty flexible. I can't do this though.
Yeah. So you hold your arm out straight, and then you try to pull your thumb to your wrist. Another one is you look at the elbows, and you look at the angle of the elbows to see if it's more than 10 degrees.
I don't think so.
Nope. And then knees, you stand up and you look at the knees if they like bend backwards. And the last one is, can the person flex forward and put their hands to the floor?
Okay.
So it's super limiting.
So yeah, you don't need to go to a physical therapist to do that. That's called the what score?
So the Beighton, Beighton, Beighton Score. So that's number 1, criteria number 1. Criteria number 2 is you have to look at systemic manifestations. Soft skin, stretchy skin, piezogenic papules. Have they had a prolapse? Have they had a hernia? There's about 12 different criteria. So, and people generally have to have about 5 in order to be positive. The second one is there a family history of connective tissue disorder? Because it's a genetic condition. You're going to you had a 50% chance of getting it from your mom or your dad. So people can prove they're in the family, it's run through their family, that meets that criteria. And then the third criteria is pain.
Yes.
Like, do they have chronic pain? Is the pain in multiple areas? And or do their joints like pop out? Do they have subluxations or dislocations in their joints? And if that's all positive, and then they have the genetic, they don't have like any signs of a valvular, a vascular, or rare form of Ehlers-Danlos, and if there's no signs of an autoimmune like Sjogren's or lupus, and if there's no signs of Marfan's or Louis Dietz, they have hypermobile Ehlers-Danlos. And so it's not really hard to go through a person's history, look for these different things.
Pretty straightforward.
I can do the assessment via video and have people diagnosed pretty easily. And even for kids, I have a lot of kids that I diagnose with hypermobile spectrum disorder or Ehlers-Danlos. Again, it's not that hard. You go through the criteria and you just talk to people and you listen to them, and it's
you get it done.
Get it done. Video. Yeah. And then talk to them about what does it mean to be in a bendy body? How do we keep you pain-free or decrease your pain for the rest of your life? And how do we address I don't call them comorbid, I call them constellation symptoms. Like MCAS, the histamines, the POTS, gastrointestinal issues, and even endometriosis, PMOS can run hand in hand with it, ADHD, autism. So just having those conversations with people about the constellation syndromes. They might not have them, but they might have them.
Yeah, and they might have them at a later time, potentially. So just putting them on their radar.
I do have to say there are some theories out there that hypermobile Ehlers-Danlos might be an autoimmune disease, might not be truly an Ehlers-Danlos condition because, to your point, it seems to get worse after people get COVID or after a pregnancy or after a trauma, a car accident, after Lyme. It's like their body falls apart. So there's some theories that this could be on an autoimmune spectrum.
Yeah, that makes sense. What does treatment look like for these patients? I imagine it has a more of a focus on keeping them comfortable, like you said. Chronic pain can be something that you're focusing on.
Right. First and foremost, I love to talk to people about how do we keep your body less inflamed?
Yeah.
How do we optimize your lifestyle?
Okay.
Whether that's sleep, stress, your nutrition, just really looking at those things because they help.
Yeah, microbiome.
Yeah, gut microbiome. Yeah. The next thing I use a lot of is low-dose naltrexone.
Me too.
Yeah,
Love that
it's
stuff.
incredible what it can do.
Yeah.
And I would say 90% of my patients with hypermobile Ehlers-Danlos are on low-dose naltrexone and find that it is incredible. I mean, it's not going to get rid of your pain 100%.
No, but it's going to smooth out the edges, like you said.
Yes, improve your quality of life.
Mm-hmm.
And I think people feel less puffy, less pain. Even their MCAS symptoms, their histamine issues can decrease. So it's a really incredible medication for this population.
I agree. I use LDN a ton, have some personal experience with it too.
Yeah.
Felt like it really helped me when I needed it most. It's not terribly expensive.
No.
It's pretty affordable.
Yes.
The side effect profile is pretty benign.
Yep.
Most patients do really well on it.
Yep.
And just feel better overall. See improvements with chronic pain, mood even, inflammation, like you said, is down. In most of these patients that use LDN, easy one to bring in for sure.
Yes. Yeah, it's really incredible for our patient population. And then based on what are their other symptoms, do they have MCAS? Because I love helping people treat their mast cell activation syndrome or deep diving into the gut. Or if they have PMOS or endometriosis, okay, let's look at your toxins. Let's look at your hormones, run a Dutch.
Yeah.
See what's going on there so we can optimize that.
Absolutely. When you bring up toxins, what type of diagnostic approach are you using? Take a sip. I feel like you've been doing a lot of talking. You must be thirsty. I'm like over here chilling, sipping my water, soaking it all in. I'm learning so much.
Yeah, toxins are fascinating. So I guess it depends on what the patient
wants to do, what their budget
what
is.
their wants. Yeah. So for example, endometriosis, we know xenoestrogens and plastics are huge in endo. And so if I have somebody with endometriosis, or PMOS, I'm going to want to look at their toxin profile in terms of like plastics and phthalates and the forever chemicals and the BPAs, and I want to have them remove all the plastics from their environment, right?
Yeah.
But if I have a patient that comes in with chronic fatigue, then I'm absolutely going to want to look for mold.
Yeah.
And look for Lyme and look for those other kind of environmental components, heavy metals too for chronic fatigue. Or even somebody with chronic pain, I'll look at heavy metals. Sometimes even for people who have hormonal changes, I will look at heavy metals depending upon their questionnaire. If they come to me and they say, yeah, I eat tuna twice a week, or, I am into pottery or I'm into painting, just asking those environmental questions to kind of get clues as to what kind of testing would help them. We're not here to spend their money. I try to ask the right questions so I don't have them spend thousands of dollars on testing, because you really could.
Yeah,
so
you can easily.
Right. So I think you do the same thing, just ask those targeted questions about their environment so you can get the best test, the best bang for your buck, so you know exactly what to go after.
Absolutely. I usually say something like, we can go as far and wide and deep as you want with testing. It's totally up to you.
Yeah.
I'll help you to make those decisions, because there's some people that are into testing and they want to know. They want the information.
And I love that. I'm like, oh, give them.
I do too. I'm like, give it to me. Yeah, let's get in there. Yeah, let's do it.
Yeah.
But there are other people that get overwhelmed with that amount of testing, and it can be a lot to digest in one or two appointments, and more information for those people isn't always the best.
Right.
I do really like the total tox burden test from Vibrant. Are you familiar with that one?
Yes.
It can give you a good overview. and a place to start. And then where are you doing your Lyme testing?
So I like IGeneX.
Same.
But I will also
Pricey.
use.
I mean,
It's
any
so
good
pricey.
Lyme testing
I know.
specialty lab is an investment for sure, but
Yep. I like
worth
them
it.
and I like T-Labs. I feel
Okay.
T-Labs is very, very accurate in terms of their fish testing,
Okay,
the
nice.
fluorescing testing. So I prefer both those companies. And actually, I'm aware of a grant
Oh,
for IGeneX for patients who are having a hard time affording the testing.
interesting.
And kiddos too
Oh, wow.
for parents. So I'll have to share that information with
Yeah,
you for
yeah.
the grants to help people pay.
That's awesome. I like IGeneX. They go to iLads. I learned about Galaxy
Yep.
at iLads. Sometimes I will just start with Quest. I know it's not the best,
Yeah.
but I do like to use insurance plans if they
Yes.
have more broad
Yeah.
coverage. And then there's one more, Vibrant. I'll use Vibrant's tick panels too.
Yeah.
Or they call them maybe vector-borne panel,
Yep.
but they
Yeah.
have the 1 and 2
Yep.
that you can do.
Yeah, as much as I'd love to use Quest, it's so hard because it doesn't test for all the Borrelia
It
and
doesn't.
Babesia.
It's like
and
one, right? One
Yeah.
species or one strain.
Right, exactly. So, I mean, if we can get if insurance will cover it 100%, why not?
Yeah.
Just run it,
Yeah,
right?
that's sort of my approach to it too. It's like, let's
Yeah.
just run it. If your insurance plan covers it, let's just see what happens. And if it's like completely abnormal, you know, like CDC standards
Right.
abnormal, I'm like,
Right.
okay,
We're good.
we're good. We're
We don't need to do
treating.
further
We don't need to
testing.
do
Yeah.
further testing.
Yeah.
I do use, you might be able to fill in the blanks. My brain is not the same.
It's hard being a mama.
I'm new.
It's hard being mama.
I feel like words are hard still.
Yeah.
It's the questionnaire that Horowitz developed. Are you familiar with
Yes.
that? It's like
Yep.
MDIS maybe.
Yep.
I don't know what it stands for, but I use that a ton because patients can essentially, it's a Likert scale that they can rate their symptoms, and then they give you, at the end of it, it kind of tallies up and gives you a score. And then that can kind of put you in a direction of like, should you do the specialty testing or not for Lyme?
Right. Yeah. Yeah, that's a good questionnaire. I actually haven't used that, but that sounds like a really nice way to kind of assess for patients whether they need to take that extra step and
Yeah.
really invest the money into finding out the information that they need.
Yeah,
or not.
absolutely.
Yeah.
I use a lot of those questionnaires. You'll get to know our portal
Cool.
next week.
Yeah. Yeah.
Love
Bye.
this. I mean, that was great. We talked about so much, covered a lot of ground.
Yeah.
I learned a lot. I can't wait for everyone to listen and hear about
This
your
is
story.
fabulous. No, yeah.
Pandas, EDS. We're so lucky to have you. I want to ask you a couple rapid fire questions. It's more of like a this or that,
Okay.
just to get to know you a
Yeah,
little
let's
bit.
do it.
Okay. Coffee or tea?
Coffee.
Duh. Beach or mountains?
Mountains.
No, really?
Yeah. I love hiking.
Do you?
I love trees. Beach, I just melt. I'm like a snow cone.
I know. I don't know why I'm saying that because I don't like the beach either. I really don't. I'm not a beach person. I think maybe I'm just like mountains. I'm a indoorsy person.
Are you?
Yeah. I'm a homebody.
Oh, we'll have to get you outside. You know, the trees actually are supposed to help. They're supposed to emit
Yeah.
something, and it's supposed to help heal you.
Really?
Like,
Is
yeah.
it oxygen?
It could be. But I think it's something else. I think it's like
Okay,
something
like,
energetic
like
wise.
negative ions.
Ion. Yeah.
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 Are you a morning or night person?
Morning.
Same. Favorite wellness habit?
Meditation.
Okay.
Yeah. I really, back to our earlier point about us taking care of ourselves
Yeah.
and walking the walk.
Yeah,
I
so
think
important.
it's really important for me to ground myself to be the best provider I can be for my patients.
Yeah.
And I know that meditating and really just creating 1 second of stillness in my brain helps me be that better provider.
Yeah. I remember, I'm going to tangent for a second. You had a story that resonated with me about, I forget how you put it, but when you were in family practice, more of like you didn't use the words revolving door, but that's sort of like how I feel like that vibe was.
Yeah.
I feel like when I was last at the bedside, that was like my last traditional job, working in the ICU, surgical trauma, very traumatic,
Yeah.
high pace.
Wow.
And just a lot of anxiety around the job, getting there on time, performing, keeping up with colleagues, proving my worth as a nurse, proving my worth on the team.
Yeah.
I remember struggling really, really bad. And I turned to meditation as like a last resort. It was like a, okay, fine type thing.
Yeah.
And I can recall I was doing 3 minutes a day.
Yeah.
That's it.
Yeah.
And
That's
I
all it
would
takes
be at the
sometimes.
computer just notably different.
Yeah.
And it didn't take that long. Why don't I do that? It's like one of those things that falls off. And then I'm like, why don't I meditate? I gotta bring it back.
Self-care always like falls off, you know, but we are like, you are the pillar for your family, right? And so you deserve that rest. It's just, it
So
is
important.
hard to like squeeze it in, but it is like, you have to prioritize it somehow. But
You
yeah,
really
it
do.
is so incredible. And you don't have to be a monk. You don't have to do it 30 minutes a day, twice a day.
No.
You know, you can just squeeze it in
3 minutes. It was
3
notable.
minutes.
That's like the moral
Yeah.
of my story or whatever. My point of the story is that it really made a notable difference in my body and like how I felt, how I performed at work. And I wasn't even doing it for very long. And I was like, wow, this stuff works.
Yeah.
It took me a minute though. Okay, favorite book?
The Name of the Wind.
I have to get to know that one.
Yeah, it's a fantasy, but it's
Is
really
it?
well
Okay.
written. Yeah.
Okay, cool. Most underrated lab? Diagnostic, I guess.
Ferritin.
Yes. Love that. For kids too.
Yes.
Yeah.
Yeah. Oh, it's fine. It's fine because no.
It's always been that way. I'm always iron
Oh my
deficient.
gosh. You know, if you walk into any neurologist's office, they're going to say above 70.
Yeah, above, I say even 50. Like,
Yes.
give me 50.
Yes.
But I do say better 70, but
Yes.
give me 50 even.
Yeah. Yes, I agree. Yeah, for
I
restless
love that
leg,
you
for
said that.
fatigue, bruising.
Even insomnia.
Yeah,
for kids especially.
absolutely. Yeah. Yep.
Favorite supplement?
Oh my gosh. So this is going to be a toss-up between glutamine, L-glutamine for the gut, because it actually will decrease your risk for getting colds in the winter as well. And so I love giving this to kiddos and parents. And then I love CoQ10. I think for some people it can really fire up the mitochondria.
Yeah.
So that one's a great one to do too.
Oh my God, Holly's gonna love that. Okay, last question, and we can wrap up. One thing patients always say after working with you.
I feel heard.
Yeah. Why am I gonna cry?
Oh.
That was so good. You crushed it.
Oh, thanks. You crushed it.
No,
you're great.
you're amazing.
You're
I
good.
can't
You're
wait
natural
for
at
everyone
this.
To meet you.
Yeah.
You're gonna do so good here.
Oh, thanks. Yeah, I'm excited.
Yay.
I'm excited. I'm really excited.
Next week can't come soon enough, honestly.